Broadcasting from New York City to the world, it's the G-Man Interviews.
Welcome. Jack Halpern, who's made 2 previous appearances on this show, is the CEO of the New York City-based My Elder Advocate, LLC, an organization that provides advocacy services and helps seniors with issues such as eviction prevention, nursing home or assisted living placement, and long-term care planning. Mr. Halpern, a 40-year veteran of the industry, joins me to explain why managed long-term care, also known as MLTCs, and home health care agencies in New York State have no real oversight. He will also explain why he believes thousands of seniors will continue to be abused or die as a result. Welcome back to the show, Mr. Halpern.
Thank you very much for having me. Please call me Jack.
During your first appearance, you said managed long-term care agencies, MLTCs, are a major reason why home health care agencies and home health aides have little or no oversight in the state of New York. For the benefit of those that may not have seen the episode Home Health Aides from Hell, could you briefly explain how managed long-term care agencies came into existence?
Yes. A couple of years ago, pretty close to the time that Governor Cuomo was elected, he decided that he was going to redesign Medicaid in New York to save on Medicaid dollars. And so he created a group of people who were called the Medicaid Redesign Team. At the time, as I remember in the last interview, we were talking about the CHAs, or the Certified Home Health Care Agencies. These agencies were really ripping off the taxpayer and providing very, very poor care, but they were also cheating the federal government and the state government by accepting everybody for home care. And many people said, hey, look, I don't even need this much home care, and providing it to groups that they were not supposed to provide it to. Like some CHAs were made only for people with disabilities. Some CHAs were for a particular religious group. Some CHAs were for people who survived the Holocaust. But they were taking all kinds of people, and the federal government lost billions and billions of dollars. No one was really punished. But anyway, to counter this type of fraud, they came up with a new system, which is basically managed long-term care. Now, as your listeners and many people do know that managed long-term care is mainly an insurance company decides that they are going to control health care costs pretty much by making many arbitrary decisions. Now, many of the owners of the certified home health agencies, or CHAs as they're called, who were ripping off the system, by political connections, were able to convert their CHAs into managed long-term care agencies, or what we call MLTCs. So you had the same crooked people who got paid all those billions of dollars were now making arbitrary decisions.
I'm with you so far, but could you provide a little more detail on what the real objective was for creating the MLTCs?
The MLTC system was created on a simple principle that everybody who joined the MLTC, and that means everybody on Medicaid home care, they would get a per capita payment of about $3,800 to $4,000 a month. And they would get that same amount whether they would have people who need 1 hour of home care, people who don't need any home care, or people who have very heavy needs. Like many people in New York, many elders in New York State need heavy care, or the 24-hour care that the CHAs were providing. And this led both to incredible fraud because as one company was recently fined and settled and then went out of business called Centerlight, and this is public information, they went out of business for their MLTCs because they were fined $47 million, which they agreed to, because they were going to adult homes and they were signing up people who were perfectly healthy, who did not need any elder care services, to the tune of 1,283 people. So this system had its built-in fraud, but the idea was that the MLTCs would get this $3,800 and they would have some people who were heavy care, some people who were light care, and they would come out ahead. That didn't work, of course, because those agencies, which were the same agencies pretty much that owned the CHAs, they decided that they wanted all light care patients. So many people were refused hours. Now, the state made it a requirement that anyone who goes on to Medicaid, whether they're going to get home care or they're going to get nursing home care, must sign up with an MLTC. Now it came to a point after about 3 or 4 years where the MLTC system is failing. The honest agencies have taken on too many heavy care patients and are going out of business. And the other agencies, they're giving very little. And these people who are forced into these MLTCs, these people on Medicaid, are not able to get the heavy care that they need.
Basically, your years-long investigation has determined that the system has failed on a number of levels.
The system has failed. A private, not-for-profit legal group called NILAG, I think it stands for New York Legal Assistance Group, has just filed a lawsuit against the Department of Health because they are forcing people to go into MLTCs, and the MLTCs are not providing the care.
Now, you claim this situation is forcing more and more seniors into nursing homes. How so?
Since many elders in New York State can't get enough hours to stay at home, many elders are being forced into nursing homes. And again, which is, really counter to what the Medicaid redesign team was attempting to not unsuccessfully to do, is to cut down on nursing home admissions. The other problem that we have with MLTCs, and also the state passed a law that nurses' aides are now supposed to get overtime. So since the MLTCs do not want to pay overtime, instead of getting 2 aides that work the whole week, one at night, one during the day, they're providing people what they call limits. Because each person can only work 40 hours, you're suddenly getting 5 aides during the week. These people are paid very, very little money. Their working conditions are just absolutely horrible. And these aides are, decent people, hardworking people.
Are the MLTCs responsible for providing home health care aides?
The MLTC is not the one that provides the home care. They actually contract with licensed home care agencies. These licensed home care agencies supply the aides. Another problem is that people are not getting 2 12-hour shifts. They're only getting live-in people. And the live-in people in a 24-hour shift can only work 13 hours, and they're supposed to rest for 11 hours. And what's happening is a lot of times these aides, when they have their 11 hours, they're leaving elders alone for hours, and these people cannot be alone. Now, they're supposed to be providing for this Alzheimer's population 2 12-hour shifts, which means that somebody comes during the day, okay, and goes home. Then somebody comes in at night who's rested and can stay with an Alzheimer's person. They don't have sleeping hours, usually Alzheimer's people. They wander all night. So that's another problem. One more problem, and then I guess we can go on to the next question, is this is a very, very big problem, and I've spoken to many people who own licensed home care agencies, is that MLTCs are warning the licensed home care agencies that if they don't provide people to the MLTC who only require a short amount of hours, they will not use them. So it's a very, very horrible situation, and it is fraud-laden.
Many home health aides are good people.
Absolutely.
However, many others have been charged and convicted with various forms of abuse, theft, and even murder, which has led many to ask if the home health care agencies are conducting extensive background checks. Now, that said, how flawed is the investigation process, and what can be done to ensure that HHA candidates are properly vetted?
What is happening is that the agencies themselves, they're certainly not good ones, but those substandard ones who are the same kind of, who are working with the CHAs, it's very hard since they pay very low wages, benefits are bad, the hours are long, but they constantly need more people because of the overtime law, so they are not being careful. The other problem is that many agencies are not complying with the law that requires that they do adequate background checks. All right? And many of these agencies do not want to spend the money that is required. Now, I do background checks for people who buy franchises from my elder advocate, and I know that could be a very expensive situation. But they need people so quickly that they will put them on and worry about that later. So there's a lot of neglect and abuse by people. The other thing is states don't share the information. And the New York State Department of Health, I believe this is true, I couldn't be exactly, but I've heard it from many agencies, they don't necessarily, like New York State, might not share information with New Jersey regarding the background of some of these aides. So you can go to New Jersey and have a record there and abuse people there and come to New York and nobody will know. You know, if an agency is substandard, it's substandard. And that substandard is based upon the fact that they are sending in bad people to many elders' homes. So they're not going to follow the law.
Aren't there regulatory agencies in place to make sure that they do follow the law?
The regulatory agency that's supposed to monitor, which is also the Department of Health, New York State Department of Health is probably one of the most under-budgeted Department of Health in the country. So they don't have enough people to monitor each of these agencies to make sure that these people are properly vetted when they go into the homes of these vulnerable clients. This has to be addressed by regulatory agencies. It has to be monitored by regulatory agencies. And it's just not. I mean, they only have 8 people to monitor all the hospitals in the 5 boroughs. So you can file a complaint and nothing will ever come of it. So home health agencies is a very, very important thing that has to be constantly monitored. Now, the New York State Department of Health knows very well which are its substandard home health care agencies. They know very well. So certainly if these people in the licensed home care agencies are the same people that were providing the care for the CHAs, and we know that turned out to be a crooked affair, why are they now allowing them to run MLTCs and licensed home care agencies? So I have had many clients who are receiving people that come in a house who sit and do nothing, don't feed the elderly, And it's a horrible thing, and it's basically forcing people to do additional hours that they have to pay for privately. People work.
Wouldn't the installation of cameras help elders and their families?
I always advise people to put in a camera if they're going to have home health care people, and then they could see what is going. It's not such an expensive situation, but it's a broken, fragmented system.
What role do state and local polities play in all this?
Many politicians, they're just not dealing. It's always cut Medicaid, cut Medicaid, cut Medicaid. But you don't have to cut Medicaid and you don't have to cut Medicare. If you just regulate what's happening now and keep pulling the fraud out of it and throwing out those businesses, these people are constantly being rewarded with continuing business. And when the system changes, they just put on a different hat because they have heavy connections, like Shelley Silver's had real connections with a lot of nursing home and home health care people. They are all very heavily connected. They belong to a group of people who vote as one bloc. They're single-minded. The leaders of these groups are the ones that tell them who to vote for, and that vote is unanimous among those groups. So they bring in a block of voters, especially in New York State, that is phenomenal. And they have people in this group who are told how to vote. They will go out and vote, and their vote is based upon having extensive connections with the governor, with the attorney general. And these people are not investigating. I mean, the Attorney General has yet to come up with any type of prosecution of these. And he's been Attorney General for almost 8 years now. And he has not. I mean, now he is, of course, doing more investigations into nursing homes, but only after some of these nursing homes get caught, because he's now running for governor and probably will be elected to governor. And he has extensive connections to nursing home people and to home health care, which is the same thing. Another fraud that's happening is that nursing home operators also own MLTCs, which is a direct conflict. So what is happening is that since the MLTCs have contracts with different nursing homes, if you go to one MLTC, that MLTC also owns nursing homes. They will force these people to go into their own nursing homes, which is direct violation of federal law. Direct violation. It is considered part of the anti-kickback statutes that the federal government has set out just to avoid this exact thing that's happening. Now, many MLTCs do also own related businesses, whether it's nursing homes, and those nursing homes own ambulance companies. Those nursing homes own drug companies that provide drugs to their own nursing homes. And the fraud goes round and round and round and round, and everybody makes money. And the whole MLTC system was created to advance the interests of these particular businessmen who are so connected to these politicians. So why would they do anything? I mean, just why would they do them? One of our senators was heavily connected to one of the companies that ran this particular fraudulent home health care agency. It just goes round and round and round, and where it stops, an elder dies. Many elders who are not getting the care at home die, or they're readmitted to the hospitals. MLTCs are supposed to provide 2 12-hour shifts. They're not doing it. If you go to a fair hearing, we have, my elder advocate has been able to get every single client of ours who needs to go through this horrible MLTC system the care that they need and monitor that care so to make sure that they're getting the right care. But the home health agencies are not monitoring themselves. They're not monitored by the government. Their aides are not monitored properly by the agencies, and it's what I call a round robin of death. It's got to stop. It's a syndicate.
Monica Arroyo Horne, who appeared in the last episode, indicated that a home health aide told her that the agency she worked for didn't provide any medical information when she was assigned to care for Miss Arroyo's mother, who suffers from dementia and Alzheimer's. When the aide was asked why the agency didn't inform her of the client's condition, she said her agency told her that sharing information on the client's medical history violates the HIPAA law. 2 questions. Is that true? And if so, how can a home health aide be expected to render quality care if they have no information on the client, especially if the client is severely disabled or schizophrenic?
Absolutely not true. When they sign up with an agency, just like when you go to a doctor or you go to a hospital, God forbid, you sign a document that the hospital can share all the relevant medical information with those people who are allowed to get that information. For an agency to say to a client, or they can't tell the aide what it's about, is absolutely not true. Because when you sign up with an agency, you have to sign the documentation. It's just like saying that you're not allowed to tell a nurse in the hospital or give that nurse in the hospital any information about that particular patient. It's not true. Many home care agencies and home care can have no training. If you have 5 aides coming in at different hours, you can have one aide today, and by the time she familiarizes herself with the patient, she's going to not be there the next day. And if you try to call the home care agency, they will not even get back to you. If you call the MLTC, now they are supposed to change people. They're supposed to provide light housekeeping. They're supposed to cook for people or provide foods. But they are so poorly trained, and what they're doing is, this is a big crime. They are sending people to various houses that don't speak English. In one particular case, this woman who's an MLTC and working with a home care agency who is Jewish, she was getting people who are Muslim. And I'm not saying, God forbid, that they're not good people, but they were coming into Jewish homes and they were praying in that Jewish home. This is something that is fine, and if they're taking care of people, but they have to send people in who are not just going to be able to take care of people health-wise, but who, they have to understand, or sending, someone in that who speaks English into a Spanish home who doesn't speak any Spanish with an elder. Here's another big problem. Many of the MLTCs, because they're paying so much money for somebody that needs 24 hours care, many of these home agencies and MLTCs, if they want to drop that care, what they do is that make the life of the elder and their family absolutely miserable by sending in horrible aides until that person says, I can't take it. These people have to go to work every day, and they can't deal with this. They can't leave the house until the aide comes, and sometimes they don't come, or they come late, or they don't send a replacement. So these MLTCs are trying to make their lives miserable, And I've had this experience myself because I've called these people. They do not get back to you. They're nasty to you. And that woman, what she went through happens 1,000 times a day. I get the call, so I know that. You're the only one that is courageous enough to deal with this. But if you get a bad aide, they're going to sit around and they're going to let your elder, lie in their own feces. They're going to not feed them. And many people, they're installing cameras. It's just, these people are not animals just because they're on Medicaid.
How can people contact you for information on your company and services?
Well, they certainly can call us. The name of the company is My Elder Advocate. Our website is My Elder Advocate, www.myelderadvocate.com. Our number is 212-945-7550. And certainly anybody, we are a fee-for-service company. We are a for-profit company, but we help many people. And all I could say is, you could, if you're having a problem or you need help getting the right help at home, call me or send me an email, which is jhalpern, HALPERN, at My Elder Advocate, and I will try to answer your questions. But please, if you need help or if you just want to tell me about that situation so that I can have the proof that I need to complain to the right agencies, I will be glad to do that. And I again, thank you for your courage. You're the only one that is courageous enough to deal with this. So thank you again.
Thank you for being here, Mr. Halpern. I greatly appreciate it.
You're very welcome.
Thank you for tuning in. Until next time, stay cool, stay safe, and stay informed.